Evening session. Welcome to this third appointment with the Health Engagement Overlaps. This time is focused on ultra-processed food and its impact on the IBD care. For those who attend this for the first time, I remind you that this Open Lab is organized by IFCCA with the scientific support of Università Cattolica del Sacro Cuore in Milan with the miGut-Health project. My name is Maria Stella De Rocchis, so I'm the project officer at IFCCA, and today I will facilitate this first part of the meeting. We will be also joined by Michael Crick, our facilitator, who will be interacting with you through the chat. So please keep an eye on it. And it will be also facilitating the workshop later on. We are here together, people living with IBD, family members, and other stakeholders to share experience, explore lifestyle factors, and talk about how we can better support meaningful health engagement in IBD care. Before we begin, I would like to thank our Danish Patient Association, CCF, and in particular our delegate and friend Bente Bertelsen, as well as Vera Slaik, for their support in inviting their members to this meeting. As you all know, during our time together, we will also share the preliminary results from the Danish cohort of the survey, to which many of you contributed, making it a success. Thank you all for your participation, for taking time to join this meeting. Second slide, please. So before we start, I would like to go through practical guidelines for everyone. I see that we have been joined by 50 people. So thank you everyone again for taking your time to follow this meeting. So all perspectives and ideas are welcome, respectful and supportive discussion. Let's make sure that everyone has a chance to talk. Help us to keep up to time. So this webinar will last approximately 1 hour and a half, and we will have a full agenda. Please keep your camera and your microphone muted and your camera on if you wish. And to speak in plenary, please use the raise hand function and unmute yourself once you are called. Write any questions or comments for the speakers in the chat. If there is time, we will bring them into the Q&A. If we don't have time, we will answer them in the chat. I would like to remind everyone that by registering, you have already agreed to the session to be recorded. If you don't agree, please leave this workshop now. Third slide, please. So here are some technicalities. At the bottom of the screen, you can mute and unmute yourself and switch on and turn off the video as you wish. You will have the full list of participants here, and you will have access also on the right to the chat. You can rename yourself. I see some background noise. You can rename your name by adding your organization if you are linked to any organization, or just your name as you wish to be called. The next slide, please. So for the first time, we will allow subtitles, and my colleague Michael will write to the chat how you can switch on subtitles in very different languages. I suggest you to switch them on only if you're not able to speak English. So the conversation will be in English, but also we will encourage you to write messages on the chat in English only. You can follow it with the subtitles if you are not able to follow it in English. But if you have any questions, you don't speak English, you can always reach out to me and I will make sure to answer you back. If you write comments in other language in the chat, we will not have time to answer all of them. So thanks a lot for understanding. Next slide, please. Now I want to start with some background information on the project behind this meeting. The miGut-Health project is funded by the European Union through the Horizon program. It began in January 23 and it will run until December of this year, 26, for a total of 48 months. The project involves 12 partners from multiple countries, and the consortium includes experts in clinical research, gut microbiome science, personalized medicine, digital health, patient engagement experts, and IFCCA, which represent the ABD patient community. The project is coordinated by the Institute of Clinical Molecular Biology in Kiel in Germany. Next slide, please. So the aim of this project is to provide personalized strategies for early disease prediction, prevention, and improving gut health for people living with inflammatory bowel disease and those at higher risk. The project focuses on finding and validating gut health biomarkers, exploring personalized ways to prevent disease, and developing tools and strategies to help people actively engage in managing their IBD. Ultimately, the goal of the project is to make disease management easier, empower patients, and bring practical, personalized gut health solutions into everyday care. Next slide, please. According to the agenda, very briefly, we'll begin by setting the scene with a presentation from Professor Johan Burisch, Professor of Gastroenterology at the University of Southern Denmark, Odense University Hospital. Following that, Dr. Dilara Usta from Sacro Cuore University will share some preliminary results from the Danish population on the survey they carry on in the miGut-Health project. Next, we will have a short warm-up session. So Michael will invite everyone to join in, and it will be a bit of a stretching session to get us ready for the workshop. And after that, we will have an introduction to the ENGAGE-IBD guide with the Professor Gwendalina Graffigna from Sacro Cuore University. And this will be followed by an active workshop on how people living with IBD can be better supported to take an active role in their health and diet. And after that, we will close the session. Next and last slide. So the objectives of today's meeting are to build a shared understanding of patient engagement in IBD care, explore together the ENGAGE-IBD guide, see how this guide can make a real difference, and identify priorities for our next Open Labs. And now, I'm thanking you, everyone. I want to leave the floor to Professor Burisch. Professor, the floor is yours. Thank you very much.
Thank you very much. I'm just going to open my slides. So hopefully you can see this slide now. If Michael or Anela can just nod if you can see them. Good. Okay. All right. So hello, everyone. As said, my name is Johan Burisch. I work at Hvidovre Hospital in the south of Copenhagen, where I am a consultant gastroenterologist treating people living with inflammatory bowel disease, and I'm also a professor at the University of Copenhagen, where I study these diseases and try to improve our understanding of them and the care. So I'm going to talk a bit about ultra-processed food and inflammatory bowel disease today. It's important always to state some conflicts of interest. So I've received consultation fees from several companies, but none have something to do with diet, but they are listed here. So we don't really understand why some people develop these diseases and why others do. We do know that there is a certain genetic susceptibility. So if you develop inflammatory bowel disease, you are born with some changes in your genes that make you more vulnerable to some changes, some influence from the environment. So the environment is very, very important in these diseases. This is a figure trying to show you here on the very left, you are born with a genetic predisposition, which is what I just mentioned. And then over time, these people are exposed to some things in the environment, and this is where diet is important. And this exposure of the environment does something, triggers the immune system, and makes our own immune system attack bacteria in the gut, which then leads to the development of these diseases. So this is mentioned here, environmental factors on the left side. So here diet is an important factor. And overall the environment is probably a bit more important, if you can do such a comparison, it's a bit more important than the genes for the development of these diseases. So diet is very important. How important is it? Well, it's so important that probably if we could change the lifestyle, make everybody live exactly like a perfect human being, like a monk or a nun, we could probably prevent 40% of all people developing inflammatory bowel disease. So this figure you see here is it's a complicated figure. It's from a research study where they took 3 big cohorts, so large groups of people in America, in Sweden, for example, who have answered questionnaires regularly over time and given information about their lifestyle, what diseases they developed, which medications they took. And so they took all these cohorts, and some of these people who took part in these cohorts, they developed inflammatory bowel disease over time. So the researchers could go back and see, okay, in the years before they developed the disease, what did they answer? What was their life like? How much was their weight? How did they eat? And so they can connect some of these lifestyle factors with the risk of developing the disease. And the researchers they developed an index with 7 factors. They're listed on the right side on the slide here. So they said, okay, if you have a high BMI, you get 1 point. If you smoke, you get 1 point. If you're not very physically active, you get 1 point. If you take NSAIDs, so for the Danish-speaking audience, these are drugs like ibuprofen, so pain medications. If you don't eat fruit and vegetables a lot, if you don't eat omega fat acids a lot, if you eat a lot of red meat, you can see them here. For each factor, you get 1 point. And then on the figure, you can see the higher the score, the more unhealthy you're living. You can see that the higher your score is, the more the black box is on the right side on the figure. And the further to the right, the higher the risk of developing Crohn's disease, which is on the top, and ulcerative colitis, which is at the bottom. Just meaning that the more unhealthy lifestyle factors you have, the higher the risk of of developing inflammatory bowel disease. So diet and lifestyle is very important. So now the topic is, of course, ultra-processed foods. This has been in the news quite a lot. And I thought it was nice just to start very briefly. What are ultra-processed foods actually? So there's a classification system called the NOVA classification, which ranks all foods in 4 categories, depending on how processed they are. You can see on the left side, the list is group 1 is completely unprocessed or very minimally processed. Fruits and vegetables, no processing at all. They are not ultra-processed foods. But if you go down the list, you'll end up with a group of foods, the ultra-processed foods, which are heavily processed. They are industrial products with additives. And the rule of thumb is that you can't make them in your own kitchen. If you look at something in the supermarket and you look at the ingredients and say, oh, okay, this would be impossible for me to do, I have none of this at home in my kitchen, then it's probably ultra-processed foods. They are artificial colors, artificial flavors. When you look at it, you can't really recognize what's actually in it. Of course, if you look at ready meals, so foods you just have to put in the oven and heat, like pizzas, then of course you can see what's in it. So of course there are always exceptions of it. So these are ultra-processed foods. And over time, across the globe, the amount of ultra-processed foods that we are eating has increased, particularly in the Western world. So this is just to illustrate it. This is from a study looking at the amount of ultra-processed foods being eaten in specific countries and the distribution of it. And just as an example, the far left side, this is Australasia and North America. And you can see the y-axis is kilograms ultra-processed food sales per capita, so per individual per year. So in 2024, you can see one individual in the US bought 140 kilograms of ultra-processed foods. This is also true in Denmark. Generally, in the Western industrialized worlds, we're eating more and more of this. And some people are living, I mean, are eating the majority of their food intake, their energy intake comes from ultra-processed foods. It's not as bad in the developing countries, but this correlates quite nicely with the countries where the occurrence, so how many patients are there, is the highest. So, and we know, of course, that inflammatory bowel disease is mostly a disease that is seen in industrialized and Western countries. So there have been some studies looking into what does this actually mean for the risk of getting the disease. And actually, most of the research has been looking at what it means for individuals without inflammatory bowel disease for their risk to develop these diseases. And generally, if you eat a lot of ultra-processed foods, you do increase your risk of developing Crohn's disease, but there's no signal that it increases the risk of ulcerative colitis. So here's one study. It's actually similar to the study. This is a summary of studies. So, and these were some of the studies that were part in the first study where I showed you that the more unhealthy living habits you have, the higher the risk of inflammatory bowel disease. So in this study, they took all the studies that have been done, usually cohort studies, so large groups of people that have answered questionnaires about their lifestyle over time. In total, more than 1 million participants took part in these studies. And they could see if they group people according to how much ultra-processed food do they eat every day, then you could divide them in 4 groups. So the 25% with the lowest intake, the next 25, the next 25, and then the 25% with the highest intake of ultra-processed foods. So this is what they mean up here on the right with quartile 1 and 4. So now they're comparing those with the lowest intake with those with the highest intake. And if you do that, you can clearly see that no matter which study they looked at, people who eat the most ultra-processed food had a significantly higher risk of developing Crohn's disease, a 70% higher risk of developing Crohn's disease compared to those with the lowest intake. But for ulcerative colitis, which is on the bottom right, there was no risk. And this is what is called a meta-analysis. So you take several studies and you pool it into one, and then you say, so what is the summary of all the findings? And the way you present this is like on a figure like this. So that the vertical line you have here on the right side, if the black box is to the right of it, then it is an increased risk, whereas if the black box is on the left side of the line, there's a lower risk. And if the black line, for example, for ulcerative colitis, is touching the line, then there's no difference between the groups. So it's just how to read these curves. But so generally, there's an increased risk for developing Crohn's disease. But it's also important to note that here we compare those who ate the least amount of ultra-processed food, which means that it's not that you don't have to touch, yet that you are not allowed to eat any ultra-processed foods. It's rather the amount of it. So those eating the 25% who ate the least ultra-processed foods, they did not have this increased risk. So you can eat some, but you need to look at how much you're eating. I think that's the most important message. So interesting, this is another study where they again took people who answered data about their diet. And here they looked at what they were eating. And then from previous studies, researchers actually know that if you eat a specific food item, so let's say it's an apple, you can actually look at the blood in these individuals and see how much are the inflammatory markers increasing. So if you are a patient with inflammatory bowel disease or you're a patient with another disease, you know that some of the blood samples that physicians like to measure are CRP. So that's a measure of inflammation. So that's, for example, one of the markers we know from previous studies that if you eat a specific food item, then the CRP increases slightly. So you can actually make an index of how inflammatory is a diet or how inflammatory is a specific part of the diet. So if you know that, you can look at what are you eating, what is your meal today, what is your overall diet actually looks like, and how pro-inflammatory is it? How much does it increase your inflammation actually? So they did this, and then they looked at the inflammatory potential, and the risk of developing inflammatory bowel disease. And here on the left side, you can see that if you ate a diet that had a high inflammatory potential, you had a 50% increased risk of developing Crohn's disease. It was not the case for ulcerative colitis. So again, we see that it's not the same. Diet doesn't have the same influence on Crohn's disease as it has on ulcerative colitis. And interestingly, this is what's shown on the right side, and it's too complex to discuss. But the point, what is shown here is actually, if you take people who start the study eating a very low inflammatory diet, but then over time, maybe they change the diet, maybe they suddenly can't afford to eat vegetables anymore, so they need to eat fast food instead of this. This could be one reason. If they change the diet over time, then also their inflammatory potential increases and their risk also increases. So it is really something, it's not their baseline risk, but it's something that was changing with the diet. Here's a list. Again, it's very small. It's just to show that they could actually look at which parts of the diet were most important for this inflammatory potential and the risk of Crohn's disease. And what's shown here is actually that some of the factors that were important were high energy beverages, for example. So Coca-Cola, energy drinks. It was red meat, processed meat, whereas things like vegetables and fish didn't have it. So as I said, most data that we have is actually how the diet influences the risk to getting the disease if you don't have the disease at the moment. There is some data looking at how you can, if you have inflammatory bowel disease, how can your diet or how can the intake of ultra-processed food influence your disease? Most of it is observational again. So there are no studies that have tried to change the diet in people over a long time, but there is a signal in Crohn's disease. There was one study where they followed more than 100 patients with Crohn's disease and who were doing fine. So the disease was quiet. And then they looked at their diets, what were they eating, and followed them for a year. And you can see that those who had a very high intake of ultra-processed food, if they had Crohn's disease, they had a 4-time higher risk of having a flare than those that had a low intake of ultra-processed food. And then another key observation is that there are actually diet forms that we are trying right now to test whether they can actually heal the bowel, bring the disease into remission. There was one diet called the Crohn's disease exclusion diet, where you actually take out ultra-processed foods. And there's another diet called Tasty Health diet that has been tested in people who have inflammatory bowel disease, who had Crohn's disease, who had activity. And I'm going to show you a bit about this in a moment. But we have to remember that there's no randomized trial where you took one group of people with inflammatory bowel disease and they didn't eat ultra-processed foods at all, and then another group that did eat it. So we can't really at this point say specifically how it's working and if it's working for everybody. So please don't go out and refuse to eat any ultra-processed foods. I'm going to get back to this, but be mindful about it. So the Tasty and Healthy diet was tested actually, and we saw the data recently last year at a conference. So this is a diet here on the left side. You can see where individuals are asked to avoid processed and canned food. They are asked to avoid gluten. They shouldn't eat animal fat and deep fried food. On the other hand, they can eat fish and seafood, poultry, vegetables, and so forth. You can see it here on the slide on the right side. So it's like some of it probably looks like a Mediterranean diet. And this was actually tested in a study where there were some individuals with Crohn's disease who had mild to moderate disease activity. So they were having symptoms of the disease. This was 83 patients, and they were randomized to either changing their diet to follow the Tasty Healthy diet, and the other half were then asked to use exclusive enteral nutrition. So what is exclusive enteral nutrition? Those of you who were diagnosed as a child, or those of you who have children who have inflammatory bowel disease, you will know this because we use this in pediatric or in children and young adults who have inflammatory bowel disease. So this is a type of nutrition that is used as treatment, and it's as effective as prednisolone. And in this study, And again, I apologize for this being maybe a bit too busy. Here they randomize people to either taking enteral nutrition or eating following the tasty healthy diet, and they could see that they were equally good. On the left side, these are the values of the stool marker calprotectin. So some of you will know this. It's a marker of how active your disease is in the bowel. And over this 8-week course, you can appreciate that the values are decreasing in both groups. And also when they asked these people about their symptoms, so the mini index and the WPCDAI, these are symptom scores where people report their symptoms. They also decreased. So eating according to the tasty healthy diet was as good as using enteral nutrition, which we know is equally good as steroids. So this is very interesting. Of course, it's a small study. It's not ready to be implemented overall, but it indicates that diet could be a treatment for Crohn's disease. So this is my last slide. What does this mean for you as a patient with inflammatory bowel disease? So overall, studies suggest that ultra-processed foods intake is associated with a higher risk of flares, although the evidence is still limited. There's more studies about getting the disease if you don't have it yet. And this is especially true in Crohn's disease. For ulcerative colitis, we see it's difficult to prove the same connection as with Crohn's disease. Whole food diets that exclude ultra-processed foods can induce remission in Crohn's disease, as I've showed you. It's important to remember that diet is one of many factors. So it's not a replacement for medical treatment, at least not if you have moderate to severe disease. That's my opinion. So you probably need also medications. But if I hope that we'll be able to use diet in connection with medical therapies in the future. So what can you do today? You can reduce ready meals, reduce the number of soft drinks, packaged snacks, and fast foods that you eat. I think that goes regardless of which disease you're looking at. It's generally a good, healthy thing to do. Eat more vegetables, fruit, fish, and whole grains. And if you are fortunate to be in a hospital where there is access to it, ask your IBD team about referral to a clinical dietitian. Because I would say if you want to experiment with your diet, it's best to do it with professionals because there's some things you can do wrong. It's complex, and you should, if possible, seek advice of people who are experts in this. So thank you very much for your attention.
Thank you, Professor Burisch. Thank you for this very inspiring data. We have many questions in the chat box. I don't know if you have access to it, if you can maybe select some of them and answer our audience. And Michael, I don't know if you are on time. We can maybe take our time to answer.
Yeah, it's okay to bring a couple of the questions up. Yeah, we have time.
Okay, so Henrik asked, what is meant by the environment? I should have seen that at the very beginning because I mentioned it quite a lot during the talk, of course. So the environment is when we talk about this in context of inflammatory bowel disease, we mean basically anything exposing you. So we mean pollution, we mean diet, we mean medications you take, other medications. We mean if you were breastfed as a child, the way you were born, was it vaginal birth or C-section? Did you have animals at when you were a child, for example? So that's what we meant. So this is the sum of everything that exposes you from the outside. Anna asks, why do kids get ulcerative colitis? Can it be caused by penicillin? So as I said in the beginning, we don't fully understand it. Some part of it is the children being born with some genes, not necessarily something they inherited from the parents, but when they were made, some of the genes were made a bit different, which means that these children are then susceptible. So they are more easily get influenced by some of the environmental things that I just mentioned, according to Henrik's question. For some reason, these exposures change the bacteria in our gut, in our intestines, in our colon. And these bacteria and maybe also the environmental factors change the immune system. And for some reason, this immune system then stops looking at the bacteria in the gut, looking at them and saying, it's fine that they're there. You might all know that we have lots of bacteria in our intestines, and they need to be there. We can't live without them. And our immune system every day makes sure that the right bacteria are there. And if we get some bad bacteria, if you eat food that is bad, or you eat from a buffet somewhere abroad, then you get disease. So the immune system looks at these bacteria, makes sure that the right bacteria are there. For some reason, the immune system suddenly stops recognizing these bacteria, and it looks at them and says, these bacteria need to go. So they start killing them. They start a process which is inflammation, and that causes then a disease that can be ulcerative colitis or Crohn's disease. And for some reason, this doesn't go away again. So the immune system keeps being like this, which also means why we can give medication to people with these diseases. The medication will reduce the inflammation, will make the bowel heal. And then again, at some point, the inflammation can come up again, maybe because something in the environment again triggered it. I hope this made sense. So yeah, and penicillin, well, we know that if you use a lot of antibiotics as a child, let's say you had a lot of diseases, lots of infections, you had lots of antibiotics given to you by doctors, then that increases the risk of getting the diseases. So yes, it can potentially be caused not by penicillin it's such, but many causes of antibiotics. It changes the gut bacteria, the bacteria in your intestine, and that can lead to the disease. It increases the risk slightly. All these environmental factors, each one of them only contributes very little. So it's not like if everybody stops using antibiotics tomorrow, then there will be nobody who gets inflammatory bowel disease anymore. It's a very complex disease, and many things, many pieces in the puzzle need to come together before the disease develops.
Maybe we have time for one more question.
One more? Okay.
Maybe you would have time afterwards to type responses to some of the others if
yes,
you have, it would be great.
So maybe I'll do that if that's okay with you, because I can talk for a long time. I can see because the questions are very good. So I'll just if it's okay with you, I'll just write a written short answer to everyone.
And also, Professor Burisch, thank you. Can we share your presentation with the participants, because many of them are asking for it?
Yes, of course.
Okay, thank you very much. Dilara, and over to you.
Thank you. Today, I would like to present the preliminary results that we conducted with the Danish population. And here I would like to share my special thanks to Bente and Vera and for their impressive efforts in terms of gathering this data. And so we were able to present this survey also in different countries, different European countries. And I'm happy to say Denmark has the highest people involved in this study. So we are also very proud of this. We can change the slide. Okay, and the next one, please. So today, now I would like to introduce the study a little bit. Why we conducted this study, because we all acknowledge that living with IBD requires people to make a lot of many small decisions during the day, and they could be about what to eat, how to plan their day, and even how to manage their IBD symptoms. But by doing this, some people may feel confident and they feel like they are in control, and they may think like, I know what works for me. But some other people may feel unsure, stressed, overwhelmed, and especially when food affects their IBD symptoms, or eating or choosing the necessary foods may become connected to their emotions. Like people may start eating for feeling more comfort, or they may avoid or limit their food because of fear. So this shows that living with IBD is not only about the medical treatment or diet, but it's also embedded in daily experiences, emotions, and how people cope with their food and their illnesses. And the next slide, I would like to explain two important ideas that constructed our survey. On the one side, we have health engagement. Health engagement means how people are involved and confident when they are taking care of their IBD. So on one side, some people may feel informed, confident, active. They are able to make decisions about their health, and they are able to face with the daily challenges that IBD management brings. But other people may feel less sure, more worried, or unsure about what to do, especially when they have a flare or when they experience more strong IBD symptoms. And on the other side, there is a psychological relationship with food. In literature, we call it as psychological food involvement. And psychological food involvement is not only about what people eat, but also how much time and energy they put into food, just like planning meals, going for shopping, reading the labels, preparing food, cooking, and enjoying the eating behavior. For some people, food is just a simple basic need, and eating feels people calm and straightforward. But some people, food brings more strong emotional meaning, and eating can become more stressful or emotionally challenging, especially because of fears about triggering IBD symptoms. Also, some people may rely on food just for comfort, which can lead to some unhealthy habits like eating in response to stress, boredom, or emotional distress. The next slide is explaining why we carried out this study. First, overall, we wanted to understand the early everyday life experiences with IBD better. We were interested in what kind of factors help people stay engaged in their healthcare and what makes it harder for them, especially when it comes to eating habits and daily routines. And the second is we wanted to see if there are different behavioral types or patterns among people with IBD, because some people feel more confident or more involved in managing their health, while other people may not. At the same time, food also can play different roles in people's lives. As we discussed before, it could be strongly linked to stress, comfort, or emotions. So looking at these together, we wanted to better understand these differences. So therefore, we can tailor the support what people actually need. So the next slide is showing how we conducted this study. We invited adult patients living with IBD in Denmark to join this study. And everybody participated voluntarily, and they filled in an online questionnaire. This questionnaire was shared through CCF. Maybe some of you had already joined this study. So it reached people who are already connected to the patient organization. And we completed the survey between the end of March and end of August 2025. So to be said, this study is based on the real experiences shared directly by people living with IBD. So here in this slide, I'm going to explain what we asked participants about. We asked about their IBD symptoms and their stool forms. We asked this because we wanted to understand if their disease was active and how their symptoms had been recently. We also asked about their stress levels, how stressed people felt in the recent days. We also asked about their stress eating habits. We asked them if they eat less or more than usual to cope with stress, because it's a bidirectional factor. So some people are more tend to eat more. Some of them, when they feel stressed, they eat less. In addition, we also asked about health engagement and psychological food involvement. To collect data, we used validated, well-tested questionnaires that are commonly used in IBD research. to be sure if the answers were reliable and meaningful and represent the IBD patient community. Apart from the validated scales, we also asked people how often they consumed some certain type of comfort foods and beverages to cope with their stress. We identified these kind of comfort foods and beverages like some sweets, chocolate, salted food or fast food or sugary drinks or alcohol, coffee, this kind of food constituted and described as comfort food. And within this topic, we were interested in their everyday habits. So we asked them if they ate or drank these items more than they normally did in the past week. We also asked if they tended to eat this kind of comfort foods and drinks more than usually when they felt stressed or emotionally tense. We also asked about their perception about the importance of consuming these foods when they are feeling stressed or emotionally tense. So our focus was to understand the relationship between stress and eating or drinking for comfort. We can go to the next slide. So here are the next slide. Thank you. So this is the population's characteristics here. So amazing number, really. Only from Denmark, we were able to access more than 1,000 people living with IBD. And the average age was around 51 years. And again, on average, participants had been living with IBD for about 17 years. It means that most people had long-term experience managing their condition in their daily life. And the next slide is showing us that the population, the characteristics of the population. Here, most participants were women here, around 80%. About half of them had a university level or higher education, and more than half of them were employed. Many of them were married or living with a partner, and almost half of the participants had ulcerative colitis. And 1/3 of them had undergone surgery related to IBD, which is expected based on the length of the condition. And at the same time, most people were taking medication for their condition. So what we can say is this group, Danish group, represents people with real and long-term experiences, but at the same time, they were also managing work, their relationships, and their treatment in their everyday life. And the next slide is showing the psychological support received. And about half of the people had spoken with a psychologist or a psychotherapist in the past, but only a small percentage of people were receiving psychological support at the time of the survey. So we all acknowledge that IBD management brings stress and emotionally challenges. And in the Danish population, most of the people are not getting professional psychological help. This could be in two ways. Maybe people are not able to access the service, or they don't need to. And also, looking at our results in terms of the validated questionnaires that I mentioned, so many participants were experiencing active symptoms. Also, many people reported looser stools than usual. And surprisingly, overall stress levels were low. Most participants didn't report high stress. And Danish people, when they are stressed, they were tended to eat less instead of more. And among Danish population, health engagement and psychological food involvement levels were high. Going to the next slide, here I would like to show you how often Danish people reported consuming different type of comfort foods and drinks in the past days. So we asked participants to choose from simple options, as you can see on the slide in the rectangular, ranging from never to more than twice a day. And overall, some foods and drinks were consumed more often than others. It appears that if we move on the slide, we will see the stars on some certain food and drink groups. So coffee, sweet snacks, and sweetened beverages were among the most frequently consumed items. This is a general picture of comfort food consumption in the last week. Moving forward to the next slide, this looks at if people ate or drank more than usual during the past 7 days. First of all, as you see in the right upper corner, not everyone reported eating more than usual, and about 24% of the participants said they had increased their intake of at least one of these foods and drinks, and the most common items were sweet snacks, sweetened beverages, and chocolates. And the next slide shows about the data related to stress-related eating and drinking. And about 36% of participants said that they tend to eat or drink these foods more often when they feel stressed. And these food groups are sweet snacks, chocolate, and savory snacks. Lastly, we asked also people the perceived importance of consuming this kind of foods from an emotional point of view. So for many participants, Danish people said that this is not a central emotional issue for us, and about 30% described their relationship with food as neutral, and almost half of them said food was not important or only somewhat important. And the next slide, here, it's a very interesting result for our study that it shows two different patterns that appeared in our results. First of all, we run some statistical analysis to group participants into based on their health engagement and food involvement levels. And in this case, first, people who felt highly engaged in their health reported fever or milder IBD symptoms, and they reported lower stress. They also showed lower tendency to consume comfort food when they are feeling stressed. But second, for people who felt highly psychologically involved with food, the differences were not only in IBD symptoms, but the important part was about how they ate when they are feeling stressed. Because when they are more involved in food, they were more likely to eat during stressful moments. And they said comfort foods felt more important for coping with stress. And here, the next slide is showing an overall comparison with the results from Germany, Netherlands, Italy, and Denmark. This is interesting because there are some important differences between these countries. For example, in the Netherlands, people were who were highly engaged in their health said that, of course, comfort food felt less important when they are stressed, but this was different. This was more strong compared to people in Germany and Italy. And when it comes to the Danish population, Denmark showed a slightly different pattern because in both groups, in both high health engaged and food involved group, they showed similarly low disease activity, but didn't distinguish between them. So it was a common result for both of the groups. But instead, the main differences were related to the importance, the dedicated importance of comfort food during stress. And of course, they had higher stress eating compared to Germany here. And the next slide is just shortly explaining an overall view of this study among the Danish population. So we acknowledge that there is no single way of living with IBD, and people have different experiences in terms of dealing with stress, how they behave with food, how they behave food, and how they engage in managing their IBD. We can go on the slide. It's okay. And perceived stress, psychological stress, clearly influences eating behaviors, sometimes more than the disease symptoms themselves. So our key conclusion from this study is feeling more engaged in health was linked to less stress-related eating. And when people have a strong emotional focus on food, it was related to changes in eating during stress, so rather than the disease symptoms. And we think that feeling confident and engaged in health makes it easier to manage the daily challenges. And we believe supporting health engagement may help IBD patients cope better in their everyday life. So this is all from my side for now.
Thank you. Thank you, Dr. Usta, Dilara. Thank you very much. I don't see any questions from the chat. You mentioned a lot of meaningful information regarding the survey, and I'm sure that the Danish Association will receive soon, also with our support, a full report of the resources. So maybe you can work and you can digest all of this data. I have one question for you, Dilara, to wrap up everything that you said. So one of the key findings is that stress influence eating behavior, and you said sometimes strongly than symptoms alone. And what do you think this means for how we support people living with IBD in the daily life? What would be your suggestion?
I mean, we all acknowledge, I think everybody experiences stress during their daily life. So it's not only about managing IBD, but also the daily life itself brings a lot of stress. And IBD symptoms are, of course, under a higher risk in terms of managing these kind of circumstances. And that's why sometimes it's kind of hard to realize that this problem, because sometimes, of course, IBD patients with IBD are very careful about their diet. But when it comes to dealing with stress, sometimes it turns into some unhelpful dietary habits. And I think it's an important study to acknowledge this part, because all of us need to do some stuff to manage our stress. It could be exercising, it could be meditating, it could be reading a book or something else. But when it comes to eating, if it turns into unhealthy eating, IBD patients are more under higher risk. So that's why I think that's the core point here.
Thank you, Dr. Usta. Thank you very much. And now this leads to the next chapter, which is about the ENGAGE-IBD guide. So once again, within the miGut project, we developed this toolkit for patients, for IBD patients, but also for families, for caregivers. That includes different chapters that will be explained by Dilara today. And if you are interested also, Bente, we are discussing the possibility within the project to have it translated in Danish. I think it's a very nice toolkit, and you will have a first look at it now, and you will also will get all of the information in our website. I will also put here in the chat the link where you can find it more explained. Thank you, Dilara.
First, let's run a little warm-up question. So we want to hear from you. So my name is Michael. I'm from Sticky Dot, based in Brussels. We're running a co-creation process as part of the project to make sure that we're hearing from people living with IBD, as well alongside caregivers and researchers and people who work with IBD. We wanted to make the most of all the expertise in the room today. We're aware there's a lot of us here. It's great to see so many people, but all with a lot of experiences and perspectives. So I wanted to put a question to you, first of all, to warm us up a little bit. I'm going to type it here in the chat, and I would like you to take a moment to think and respond in the chat. So we've been exploring patient engagement, health engagement. I'd like you to think about, from your experience, the information and guidance that's given to people with IBD, information and guidance about health and diet. What do you think is missing from, in your experience, from what people with IBD are given? So I'd love you to take a moment to think about the question and type your response in the chat. I just give you a minute to think and type. Is it clear? Yep, great. Great to see some responses already coming in. Take your time to still, if you're typing, you have still time to finish. If you're already finished, you can read through the responses that have already been written. And if you see some that really resonate with you, you can give them a little thumbs up response in the chat. Great to see your responses. So you still have time if you want to add something, but I already want to ask. So Winnie, lots of people responded to your comment on the importance of diet. Do you want to elaborate? I don't know if it's possible for you to unmute yourself and elaborate a little on your point. Maybe you're not at the screen at the moment. Yep.
Yeah.
Yeah, you mentioned that diet, the importance of diet, that this is missing from what people living with IBD receive.
No, actually, we addressed the dietists at the hospital where Johan is a professor at Hvidovre in Denmark. And we were met a couple of times by the dietist there that it was actually without importance. And we said, how can it possibly be? It didn't fit our expectation. It didn't really make sense. And therefore we were very surprised. And of course, we have a son who has Crohn's,
Right.
and he's 17 and has had it for 3 years. And having the meetings with the dietist, to him it was like, okay, but then I'm safe. Then I can do exactly as I wish and want. And that was a huge surprise, first of all, to my wife and I. And then secondly, it was very difficult to take the discussion, having a clear idea from our point of view that it would actually matter. And there's no doubt that he had been consuming the category 4 foods to an extent, which certainly hasn't been in favor of his Crohn's. And therefore it's actually a thing which we've returned to.
Yeah, and I see that you're not alone in the chat. I see lots of responses around lack of support around diet. That seems to be a very clear one. I also want to thank you for sharing with us.
Of course.
I also wanted to ask Laura, you mentioned personalized medical care. That's also got some responses. Could you, I don't know if you're able to unmute yourself.
Det er bare fordi det er så lavt. Hvorfor kan man ikke skrue op?
Oh, sorry, I think it was somebody else unmuted. Laura, are you able to unmute yourself? Maybe you're not free to talk at the moment. Okay, no problem.
If I can say, Michael, personalized medical care is one of the recurring ones among IBD patients. We had also a nice webinar on this last year because in oncology, for example, they made a huge progress, and the personalized medicine is saving actually lives. But we are still very far in IBD care. And I also find it extremely important. And the challenge is because IBD is quite a challenge disease, as also Dilara mentioned before. But I'm happy to see it listed.
Yeah, thank you all very much for sharing, and some other great suggestions on what's missing. Follow-up and daily monitoring, a cookbook, great idea as well to help support, and as Helle says, on adequate nutrition as well. Yeah, thank you all very much. We'll have a chance to talk in more detail in a moment, but let's first go back to Dilara to hear a little bit more about the guide that we're producing as part of the ENGAGE-IBD project. Back over to you, Dilara.
Yeah, thank you. Because I saw Louise said that I've never received any information from the hospital. And this is a really hard challenge, actually. So I think that's why ENGAGE-IBD could be a nice tool. You know, we developed this educational tool. Now I'm gonna describe in detail. We can go to the next slide. I think it could be a good basis. So as the Università Cattolica and IFCCA team, we developed ENGAGE-IBD, personalized health engagement.
I cannot hear anymore. Okay, yeah.
Are you able to hear me?
You are a bit slow, Dilara. You are a bit freeze. I don't know what's happening.
I am okay. My connection is not stable, probably. Is it okay now?
Seems a bit better. Let's keep trying. Yeah.
Yeah, now it's okay. Yeah.
Okay. If not, I'm gonna change rooms. Okay, but I will do my best. Okay. So literally, ENGAGE-IBD. It's an easy to remember name, an acronym that we produced, which brings together the most important areas of everyday life with IBD. And actually the idea behind ENGAGE-IBD is to organize and define some key aspects of living with IBD into a simple and structured framework that IBD patients can easily remember and apply in daily lives. For this reason, we developed the ENGAGE-IBD patient guide as an educational resource to support people living with IBD in terms of managing their condition more effectively. Actually, rather than focusing on medical treatment, ENGAGE-IBD addresses multiple dimensions of living with IBD, including lifestyle, emotional well-being, communication with healthcare professionals, self-management skills, and our overall objective was to provide a patient-friendly tool. So the next slide, now I will try to explain how and why we designed ENGAGE-IBD tool. Of course, we wanted to help people living with IBD to feel more informed, more confident, and more supported in managing their condition. Our goal was to enable people to take a more active role in their health, so improve their health engagement, and to better navigate their daily life with balance and control. And the key principle is that patients are not passive recipients of care. And living with IBD is a unique experience, and everybody experiences it in a different way. And it requires making continuous health-related decisions, adaptations, coping strategies. So that's why this guide aims to improve IBD patients' ability to actively engage with their health and with their care. And I would like to underline this part because ENGAGE-IBD was developed with and for people living with IBD. So not only the researchers, but real patients reflected on their real experiences and their perceptions throughout the development process. For example, you can also see on the slide here, IBD patients told us that also many of your comments are already included in the chat. People told us that nutrition and stress are deeply interconnected. And so both of these aspects need to be addressed together. Also, IBD patients told us that the general advice is often not enough. And so that's why the information that is given to the patient should be personalized and should be flexible, because IBD experiences, as I said before, is unique to everyone and it can change from day to day. So every day is not the same. And also people highlighted the importance of practical skills. So it's not only about simply receiving a list of recommendations. They also told us that they need to feel mentally ready and supported when making health-related changes. So these are the fundamentals in shaping ENGAGE-IBD guide. And we try to ensure that this educational tool responds to real patient needs and everyday challenges. So who is ENGAGE-IBD for? The answer is anyone involved in IBD care. So it's the guide is intended for people living with IBD. It means that IBD patients, but also we believe that this guide can be useful for caregivers and family members who are actively supporting individuals experiencing diagnosed with IBD, because IBD often affects not only the patient, but also people around them. And having an accessible information can help caregivers to better understand the patient's experiences and needs. And finally, ENGAGE-IBD is a supportive tool for healthcare professionals, including clinicians, gastroenterologists, nurses, psychologists, dietitians can use this guide as a resource to facilitate the communication with patients and to encourage them a more collaborative and patient-centered approach in IBD management. So in this sense, we may say that ENGAGE-IBD is developed not only as an informational tool, but also is a bridge that supports dialogue and shared understanding between all stakeholders. The next slide is trying to answer the question of what does ENGAGE-IBD include? It includes practical tools for everyday life. And ENGAGE-IBD guide combines many practical information, supportive tips, interactive tools that can help patients translate the knowledge into everyday action. So it's rather not only presenting only general information about IBD, but our goal is to provide some concrete and useful strategies that patients can apply in their everyday lives. And just let me shortly introduce what does ENGAGE-IBD include in the next slide. In my first slide, I mentioned that ENGAGE-IBD is an acronym that are planned. Are you able to hear me? Can you hear me? Okay, good. Which makes it easy for patients to navigate and focus some topics that are ready management. And importantly, the guide is designed to be used in a flexible way. So there are 9 different domains of IBD self-management, but patients or users don't necessarily need to read it from beginning to the end. And they can move between sections, whatever they need, depending on their needs at any moment. So each sections here, each letter represents one domain, one key area of living with IBD, and together these sections also cover the different aspects of emotional, physical, and everyday well-being. For example, as you see, the guide starts with an introduction, then goes with E, educate yourself about IBD and navigate healthcare resources, and so on. So we start with an introduction and educational content to help people better understand IBD and how it can affect daily life. Then it includes sections to support patients in terms of navigating healthcare resources. So what kind of clinicians are involved in IBD care? What happens to you? So who do you call? Who do you consult? And how you should ask your questions to the clinicians and so on. And also we try to involve some most frequently experienced symptoms. And also, of course, some useful tips to improve adhering to the treatment plans. And then another important component is about active participation in decision making. So we wanted to encourage patients to communicate openly with their healthcare team and take part in terms of choices about their care. And ENGAGE-IBD guide also addresses the emotional well-being, and it acknowledges the importance of stress management and also the importance of balanced nutrition and the importance of building a supportive network of family members, peers, and healthcare professionals. The final part covers defining short and long-term health goals to help patients to think about their future and take steps forward, maintaining their health and quality of life. And my final slide is recapping the special features of the ENGAGE-IBD guide. First of all, it's designed to be flexible and personal because everybody experiences the disease in a different way, as we mentioned before. There are fluctuations in symptoms and different levels of energy levels, so people's need can change over time. So that's why ENGAGE-IBD doesn't follow a rigid path. Instead, users can choose the sections which are most relevant to them and anytime, and they can follow the material at their own pace. Second, ENGAGE-IBD is intended to be supportive, but not prescriptive. So The guide doesn't tell people what they must do. Rather, it aims to support reflection, encourage informed decision-making, and also to promote open communication with the healthcare professionals. So it acts as a resource to help people explore some options and to better understand their own experiences. And finally, the guide adopts a whole person approach. It's a holistic approach. So it acknowledges that emotional well-being, stress management, eating habits, and everyday life decisions, integrating with medical information and psychological and lifestyle aspects of health. So it acknowledges the person as a whole, not only the condition itself. This is all from my side for now.
Thank you very much, Dilara. Yeah, really nice to have a reminder of the guide, and I can see some positive reactions in the room as well. So back over to you. We have 15 minutes left, and I would love to hear some more about your thoughts on what could support people better. We've talked about what's missing in the first round of the chat. Dilara has talked a little bit about how ENGAGE-IBD can support people. But I'd love to hear from you. So again, to type in the chat in response. So thinking about the information and guidance that people do or don't, as we've seen, don't necessarily receive, how should people living with IBD be better supported to take an active role in their health and their diet? So again, I'd like you to type in the chat your thoughts, and then we will hear from some of you a little bit more. So please, is it clear, more or less, the question? Yeah, great. So just a minute to type.
If I can start commenting, Michael, because these two are very interesting. So Zuena is recommending a kinesiologist as a to pain relief, I guess.
Yeah, Zuena, would you like to tell us a little more? I don't know if you can unmute yourself. Zuena, if you would like to comment.
Yeah,
Yes.
because here, yeah, we talk about multidisciplinary team. Yes. Oh, yeah.
Can you hear me?
Yes.
So I'll try.
Yes.
Well, kinesiology in Danish, in English you call it muscle test.
Okay.
It is actually an American chiropractor. What you call the one putting your bones right? Chiropractor.
Chiropractor, yeah.
Yeah. Who I read who found out that each muscle has a connection to each organ. I've been using this for so many years, and when I go there, she can easily test my food. What can I eat? What can I not? If she puts the food on my stomach and press my arm, I cannot hold my arm at all if I'm weak with this food. But if it's good for me, the hand is strong. Now, of course, she can be more or less clever. So you need to make sure. But the thing is, this makes it easy for me to take all this I leave out. All these foods, I leave them out. I keep to what she says. Then the foods that she said I should leave out, sometimes I try them, see what happens. And then I can see it goes very bad. Of course, it's also dependent if I'm stressed. If I'm stressed, there's more food I cannot eat. When I'm not stressed, I can eat a little. But it's actually easier for me to leave out sugar 100% than to eat a little. Because then you want more. And when you leave it out, you don't desire it. In the end, I had operation from I was 7, now I'm 60. I think I have IBD also because I have some infection in my intestines, but I've had so many operations, so I have several stomach diseases. I have 46 centimeters scars in my stomach, and they removed some of my intestine. But the doctors today say, I can eat only this food, and I put to them a lot of vegetables, a lot of green stuff, but I need to blend it. It needs to be blended because I have narrow spaces, parts. For my situation, I can be, So the doctors, they say, wow, this is amazing. You can keep this intestine going. Well, I don't take any hospital medicine at all for years and years. I don't. I have always, I use acupuncture also, which helped a lot for my diarrhea. It stopped it and put me back again because I can have, I won't go in all these details. That'll be too much. But the food it's quite interesting that I also have allergies. And the doctors, they say, well, if you want to know what you can eat, stay away from this food for 5 weeks. Yeah. And then try eating it. And that's actually where the kinesiology, what you say in English, she gives me a shortcut to that, because when do you finish all foods? So when she said, stay away from this, I can try it after a while and see what goes on. And things can also change, but sugar is really, really harmful.
Got it. Yeah, thank you very much, Susanne, for sharing. I would like to say it's been really important to get some personalized support from a range of sources. So thank you very much for sharing.
But I know exactly my stomach now is hard, it's soft, and I can eat this, and I shall eat this. I shall eat this. I shall eat this. So
yeah, definitely.
I'm just. But it's hard.
I appreciate it. Yeah, I will try and make a bit of time for the other comments as well. Thank you so much.
If I may just finish to say, it's hard to go out because I have to bring my own food. So what I didn't finish to write was that inform friends and relatives to understand and help and support, because it's people cannot imagine which big work it is.
Yeah, that's it. Getting
and that time. So that's thank you for listening, and I hope your study will come out to the doctors.
Big thank you, Susanne, for
thank you so much
for sharing your thoughts. Yeah, absolutely. So that support from the entourage, very important as well. Anna, I wanted to come to your comment about a guide like ENGAGE-IBD for people on diagnosis, and also a version for children. I think is a really interesting idea. Would you mind sharing a bit more, Anna?
Hello. Well, when I was diagnosed, I got my diagnosis a lot of years ago. I didn't get any information about the diet. Everybody told, no, it doesn't matter what you're eating. So I think it's very important to inform people about the disease, and I was also lacking a lot of information about how it could go into your you're hurting your when you're moving, going into your hips and everything. And I was lacking a lot of information about that. And now I have a kid with the same diagnosis as I have. And I think they're a bit better, but they're still lacking something that you can bring home, a little book or something for kids. That could be a great idea.
Yeah, really nice idea, an adapted version in simpler terms for children. Yeah, thanks very much for sharing your thoughts as well. I wanted to come to Henrik's comments about structuring information, the fact that information comes across a bit fragmented. Henrik, could you tell us a little more?
I can. I've had a son with Crohn's for 10 years, and I tried really to stay engaged as a parent. But I was really, struck by the how unstructured things are, and seeing this guide that you guys are providing is just really, really amazing. And especially the fact when you're a parent, you feel like you're kind of watching when you have an adolescent. I mean, he was 17 going into his youth. They don't want you involved. How do you get involved in a smart way? How do you get them to realize things so you change their behavior? I mean, a young man at 20, 22, 23, they don't believe they're sick, but they are. And I think maybe this is a great tool to sort of break down that wall.
It's really great to hear. Thanks so much, Henrik. Yeah, good to hear that it can be some support. And Silke, you were saying in the chat as well that for you, you really count on internet for your information. Yeah, how has that been for you? I wonder if you wouldn't mind telling us a little more. I don't know if you're able to unmute yourself, Silke. Yeah.
Yeah, it's kind of been it's frustrating. It's about a month ago I got diagnosed with colitis, and I just got some medication, and I don't know quite. I know why I get it, but I got yeah. Sorry, my English is bad. So for me, it's kind of frustrating. So I'm just trying to find out what's next. I got a doctor that said to me I should try to tap out of my medication, and so I only take it uh, uh, 3 times a week, and that that got me very sick. So I had to start over and tap up, take the medication at full time again, and I got so sick with pains and symptoms. And now I'm fine with the symptoms are gone, but I'm just lagging. I need information of what to do when I get to the hospital, and how to talk to them, the doctors and such.
Yeah, that's it. So it's support, not only finding that information online, but how to find that support as well.
To navigate in all of this. On Thursday, I'm going to a dietitian. So if anybody has some advice for me to take with me, that would be nice. So I can be how do you say it? So I can be strong about how to manage everything.
Thank you so much, Silke, for sharing your story. And I can see that Vera has already replied in the chat.
Okay, thank you. Thank you so
I
much.
hope as well that the IBD guide, the ENGAGE-IBD guide will help support you with this. And thank you all very much for sharing your stories. I realize this is some really challenging situations that you're going through with this. So I really wish all of you the best with it, and that you get the support that you all deserve with this challenging condition. A big thank you to all of you for joining in the discussion today. It's been really enriching. It's been great to hear from all of you with these different perspectives. Maybe we can share the final slides to explain a little bit about the follow-up. So this is just part of a process. Next Open Lab, you will hear from us about it. It's happening on the 27th of April. And there we'll, after this, focus on the Danish community. We'll be working with the Greek community, but again in English and open to everyone. And then we'll be having an in-person Open Lab in Milan. And again, you will hear about us if you are following us. We'll keep you updated. So we look forward to hearing more from you then. We have a short feedback form about our session. If you have a moment to fill it in, I've put a link in the chat. We'd love to hear from you. And also, if you have more ideas, there's a chance to share them in that feedback form as well about how we could make the most of this ENGAGE-IBD guide. But it just remains me to thank all of you for your fantastic participation today. We really appreciate your time. Maria Stella, maybe I hand over to you for a final word.
Yes, thank you, Michael. And I want to echo your words. It was a very interesting session. We spent 1 hour and a half together, and we got many insights. Because this conversation will be part of a report that we have been elaborating for this project, and it will be available soon also for you. Join us in this very long discussion. If you want, you can participate in the next Open Lab. If you are interested to know more, even when the project ends, please let us know, come back to us, and we will come back to you, Bente and Vera, for the ENGAGE-IBD guide and the possibility to have it translated in Danish. I think that many people here today found it very useful, so I'm very happy to hear this. Yes, thank you very much again, and I hope to see you very soon. I wish you a lovely evening. Thank you all. Bye.